and today I'm gonna teach you the anatomy of the muscles of the shoulder region. I'm your tutor, Dr. Marina, and this is our topic for today. So let's start. The muscles which move the pectoral girdle, we have three main group of muscles here, and the first group, this is the muscles which connect the upper limb to the thoracic wall. The second group, the muscles which connect the upper limb to the vertebral column, and lastly we have also some short muscles between the scapula and humerus, and these muscles they connect the scapula to the humerus. And we're going to pass through all these muscles one by one. And the first muscle on the agenda today is the Pectoralis major muscle. It is the biggest and the most powerful muscle of the first group. And it has two origins, we call origins heads. So it has one clavicular head, which arises from the middle end of the clavicle here, and it also has a sternocostal head, and sternocostal head arises from the anterior surface of the sternum and anterior surface of the first 6 costal cartilages. Here you see these red lines, which show for us the wide area of origin of this muscle. The fibers of Pectoralis major we converge laterally to one strong tendon, which inserts to the lateral lip of bicipital groove of the humerus, which we also call the crest of the greater tuberosity. Here it is. The muscle is innervated by the lateral and medial pectoral nerves, and the main function of this muscle is the adduction. This is a powerful adductor of the upper limb, and in the same time it also can rotate the humerus medially. Why? Because the greater trochanter and the crest of greater trochanter will lie a little bit laterally, so of course the contraction of this muscle, it will pull and rotate it a little bit medially. Just under the Pectoralis major muscle we have one more pectoralis, the minor one, and it arises from the anterior surfaces of the third to fifth ribs, and the muscle converge laterally from these 3 points of origin, and it inserts by one tendon to the tip of coracoid process of scapula. This blue point here, it shows for us the insertion of this muscle. Really, this muscle is not very powerful. It is innervated by the medial pectoral nerve, but when all fibers of this muscle contracts, it can pull the coracoid process a little bit downward, and we call this movement the depression of the scapula. That means it participates in depression of the shoulder. One tiny muscle called Subclavius is located between the first rib and the clavicle, and if you remember our last lecture we had a costosternal ligament here, so this muscle it just overlaps the costosternal ligament, and it arises from the first costal cartilage here below and inserts to the middle third of the clavicle. Logically, contraction of this muscle, it can pull the medial end of the clavicle a little bit down, but I don't think this muscle is a powerful one. It looks mostly like a rudimental muscle. We have some special nerve. This is a nerve to Subclavius, which supplies the Subclavius muscle. Serratus Anterior. It is a wide muscle which covers anterolateral surface of the thorax. It arises from anterior surfaces of the 8 upper ribs. You see these marked areas here showing the origin of Serratus Anterior. Then its fibers converge toward the middle border of the scapula and insert along it. The long thoracic nerve innervates the Serratus Anterior muscle, and it actually lies between the thorax and scapula and plays an important role in fixation of the scapula. But it also can act as a protruser, pulling scapula forward and participating in its rotation. That usually happens during wide movements in the shoulder joint. Now let's look at those muscles on the back. The trapezius muscle is large and superficial. It's a complicated muscle and it has two parts, the upper part and the lower part. The upper part, it arises from the external surface of the occipital bone, where we have the occipital protuberance and the nuchal line, the nuchal ligament, and from the O line below, there we have the spinous processes of C7 to T3 vertebra. The lower part is a continuation of the upper one, and it arises from the spinous processes of T4 till L1. All fibers, they converge on the spine of scapula and insert along the upper edge of around the acromion and even along the lateral third of the clavicle here. The accessory nerve innervates this muscle, and it has a little bit complex function because when the hollow trapezius contracts, it retracts the scapula, it pulls two scapulas together toward the midline. But when the upper part contracts, it elevates the scapula, it pulls it up. And when the lower part of the muscle contracts, it even can participate in depression of the scapula because it will pull the spine of the scapula downward. Latissimus Dorsi. Latissimus Dorsi, from the Latin language, latissimus means the widest one, and it is really the widest one. It has a very wide origin, and it arises from the lower part up like this. It starts from the iliac crest here on the lower part of the back and from the lumbar fascia. Also, it arises from the lower 3 or 4 ribs and even inferior angle of scapula. So all these red lines here you see, they are the origins of this muscle. The fibers converge together and insert to the floor of the bicipital groove of humerus here. Latissimus dorsi is innervated by the thoracodorsal nerve, which comes here from the brachial plexus, and it has multiple functions. First of all, it adducts and extends the arm in the shoulder joint. Additionally, it can rotate arm medially. When we have some small muscles here, and one of them is the levator scapular muscle. It arises from the transverse processes of the first 3 cervical vertebrae, from C1 to C3 or sometimes even C4, and from this level they descend downward to the upper angle and the medial border of the scapula. Here you see this line of insertion. The dorsal scapular nerve is the nerve which supplies this muscle, and the elevation of scapula is the function of it. From here this name, the levator scapular. And we have two twins, two muscles. They are called rhomboid major and rhomboid minor. They are very similar in the shape. The only difference is the size. And the rhomboid muscle, it arises from the nuchal ligament and the spinous processes of T7 and T1. And the major one arises from the spinous processes from T2 to T5. And the fibers, they goes downward laterally to insert along the middle border of the scapula. You see the rhomboid minor, it inserts a little bit above, and the rhomboid major, it takes the lower part of the middle border of the scapula and inserts here. The dorsal scapular nerve supplies both muscles, and this muscle, it has a double function. It retracts the scapula and it pulls it a little bit upward and medially. What we have next? Next we have some muscles on the lateral part of the shoulder, and with big triangular muscle. It is called the deltoid. It is a complex muscle again, and it has a wide origin. It arises from the external surface of the lateral third of the clavicle, from the acromion externally here you see, and around the acromion from the spine of the scapula. And from here the fibers, they converge downward to be inserted into the deltoid tuberosity. You remember this tuberosity on the lateral surface of the shaft of the humerus. So this is the area of insertion of this muscle. Axillary nerve is a specific nerve which innervates this muscle. The function of the third is complicated a little bit because it has a anterior, lateral and posterior parts. So the anterior part, it participates in flexion and medial rotation of the arm. Posterior part, it extends and laterally rotates the arm. And the middle part, it abducts the arm. On the posterior side of the shoulder region, we can find the supraspinatus muscle. It arises from the supraspinous fossa of scapula and it passes laterally under the acromion. Here we have some bursa, the subacromial bursa, and it inserts to the greater tubercle of the humerus and capsule of the shoulder joint. The suprascapular nerve innervates this muscle, and the function is important because it initiates and assists in abduction of the arm. Pay attention, the function of supraspinatus is initiation of the abduction. It doesn't perform the full amount of abduction of the upper limb, but it initiates it and make the first step, the beginning of this moment. And after that, the lateral part of the deltoid muscle, it continues to abduct the arm. In the lower part of the posterior surface of the scapula, we can find the next muscle, and it is the infraspinatus. It arises from the infraspinous fossa, or I would say from the upper 2/3 of it. And the tendon of this muscle, again the fibers converge toward the greater tuberosity, you see, and we insert here. The muscle is innervated by the suprascapular nerve, and the main function of it is the lateral rotation of the shoulder joint, but also it play an important role in the stabilization of the joint because it helps to hold the humeral head and glenoid cavity of scapula. Just below we have two teres muscles, the teres major and teres minor. Let's look to the teres major first. It arises from the lower third of lateral body of the scapula. And here it is, and it goes laterally toward the middle lip of bicipital groove of humerus. Here it is. And this muscle is innervated by the lower subscapular nerve. And you see the contraction of this muscle, it will abduct there and medially rotate the arm. And one more tiny muscle connects the scapula to the humerus, and this muscle is the teres minor. And it arises from the upper 2/3 of lateral border of the scapula, and from here it goes laterally and inserts to the greater tuberosity of the humerus. The axillary nerve, it gives some branch to supply this muscle, and the muscle participates in the lateral rotation of the humerus as well as in stabilization of this joint. Subscapularis muscle is a very large and wide muscle. You can see it here. It arises from the whole subscapular fossa on the anterior surface of the scapula, and from here the fibers goes laterally. We perform one tendon which inserts to the lesser tuberosity of the humerus. The subscapularis muscle, it is innervated by the upper and lower subscapular nerves, and in function is the medial rotation of the arm, but it also participates in stabilization of the shoulder joint. The muscles which have close relation with the shoulder joint are in one clinically important group. We call it rotator cuff. And there are four muscles actually. They are the subscapularis muscle, the supraspinatus muscle and infraspinatus muscle, and the teres minor muscle below. What is common in all these muscles? Have a look. We send their tendons toward their shoulder joint, and actually these tendons we are fused with the fibrous capsule of joint and with the ligaments of this joint around. So they play a very important role in reinforcing and stabilization of this joint, and they prevent the dislocation of it. The tearing of one or another tendon in the rotator cuff, it makes a very bad preconditions for the functioning of the joint in the future. So usually during examinations, the clinicians were very attentively look into the rotator cuff and examine it proper on MRI and other methods of examination. And one more muscle which actually connect the scapula to the humerus is the coracobrachialis muscle. This is the muscle of anterior compartment of the arm, but it arises on the tip of the coracoid process and inserts to the anterior surface or middle surface of the humerus here, middle third of the middle surface. Here it is, this point. And this muscle is innervated by the musculocutaneous nerve. And usually we look at this muscle when we talk about the muscles of anterior compartment. It participates in the flexion of the arm. And now let's review the muscles we have learned today. First group was the muscles which attach the upper limb to the thorax. And here they are. Have a look at the pectoralis major muscle. It is cut here on this picture. Under it you see the pectoralis minor muscle. The Subclavius muscle here on top, and Serratus Anterior on the lateral side of the thorax. And on our available plastic modules, we can find all these muscles again. The pectoralis major, here it is. Just under the pectoralis major we have the pectoralis minor. The deepest muscle here is the Serratus Anterior, here it is. And finally the Subclavius muscle, tiny muscle on top here. On the posterior side of the human body you can find the Latissimus Dorsi muscle, here it is. The Trapezius was removed to show the deepest muscle. And here you see the rhomboid minor and rhomboid major muscle. The Levator Scapula is a little bit cut on this diagram. The Supraspinatus, Infraspinatus, Teres Minor and Teres Major again. The Trapezius muscle here in the upper part of the back, the Latissimus Dorsi below, rhomboid minor muscle and rhomboid major, they are like twins, and finally the Levator Scapula. And the shoulder joint is covered by the deltoid muscle. Above the spine we have the Supraspinatus muscle, below the spine we have the Infraspinatus muscle here, and two teres muscles, the Teres Minor above and the Teres Major below. And you see the long head of triceps comes here and it enters the space between two teres muscles. So above we have the Teres Minor and below we have the Teres Major. On the anterior surface of the scapula, the Subscapularis muscle lies. Here it is, all this white muscle.